Hey guys, Johnny here from Cheltenham Chiropractic. Got a live patient example today. So we've got a painful fourth finger around here, and it's been going on for about 3 months now.
Yeah.
And you work as a beautician, so a lot of repetitive movements with your hands. Okay. And you have had some periods where it's actually triggering on you. Is that right? So a common cause of this kind of injury is something we call trigger finger. And basically what happens is if you use your fingers repetitively, you can get to the point where the finger feels like it locks, and sometimes it actually does lock, and you have to almost reposition it out, and that can be quite painful. So today we're going to have a look at what's going on with this finger. We suspect it will be trigger finger, but we're going to have a quick scan and have a look. Okay, so we're going to go for an ultrasound scan of this finger. Now ultrasound's brilliant for finger pain because it looks at all the soft tissues, not just the bones. The bones rarely cause problems with the fingers. Okay. So the first thing we do is we actually get the tendon in the middle of the screen. I'll just point that out to you. So the tendon is this cylinder here, the bright white line, and then we just follow that tendon down. And what we are looking for specifically with trigger finger is something we call the pulleys. Now if I just have a look at this is normal, and there's a slight thickening there which is normal, that's a pulley. And if I just change the position of the probe, what you'll see is a nice image there as we move the finger in a second. Watch here, and there's the joint there, really clear view. As I move that, you'll see those tendon fibres moving. So in trigger finger you often find that it triggers underneath the pulley. However, in this case, this one looks normal, but if we move a little bit further up the finger, there is a slight, let me zoom in slightly, thickening here, just there, very hard to see sometimes, and that is where the problem's occurring, and you can see there's some fluid around here as well. But the fingers are very small, and it takes this is like 4 times magnified, so it always makes it look a little bit worse than it actually is. Okay, so let's just see if there's any inflammation happening around here. Okay, so this is what we found. We've got the A2 pulley here, and as you can see there's a small amount of inflammation there which would match up with pain and triggering in this region. So this is a trigger finger of the A2 pulley. Okay, so we have sterilised the finger and the hand. I'm just going to pop this small needle just into the pulley, so nice and still for me. Perfect. And that's done. Okay, so that's all done. Rather undramatic, isn't it? How did you find that? Was it really sore?
No, it's fine.
Sharp scratch?
Yeah.
Yeah. So most people get a bit worried about injections, obviously, because it's not the nicest thing in the world. But realistically, under the ultrasound, it's not that painful. It's very accurate, so it's just in and out very quickly. So we will review this in 3 weeks' time and see how you're getting on.
Brilliant.